Hey guys, so in this video for our Medicare series, we are going to break down the parts of Medicare. And Medicare can be really confusing because there's a lot of different letters, there's a lot of different moving parts. And so this is the foundation of Medicare that you need to understand when going in these homes and being able to discern what parts and what plans seniors are talking about in these homes. So Medicare is broken down into four main foundational parts. You have part A, B, C, and D. So let's take a closer look at each of these parts. And once again, this is not to be confused with plans, G and N. Those we'll talk about later. Those are Medicare supplements, but we are talking about the parts. So once again, A, B, C, and D. Let's talk about Part A first. Part A is hospital insurance. So it covers inpatient care in hospitals, it covers skilled nursing facilities, it covers some home health care, and it covers hospice care. Once again, like I mentioned in a previous video, most people are not paying for their Part A premium as long as they or their spouse paid Medicare taxes while they were working. For the purpose of our selling, a lot of seniors, when they turn 65, if they are still working, their employers will make them take Medicare Part A, and then whatever the employer insurance will pair with that Part A coverage. Most people over age 65 will have at least Part A because it's free, and if they are retired, they will definitely have Part A if they have the working credits. The next part is Part B. Part B is outpatient services. So the way I always say it is A, B, in, out, right? That's an easy way to remember. A, B, in, out. B is outpatient services. So think doctor's visits, most home health care, durable medical equipment they may need, prosthetic legs, think nebulizers, CPAP machines, all things outside of hospitals, outside outpatient, will be covered under Part B. Now, normally Part B requires a monthly premium. So if you go into a house and they say, you ask them, oh, are you paying for your health insurance? And they say, oh yeah, I'm paying about $165. Well, here in 2023, that is the Part B premium. Pretty much everyone has to pay that. Now, if you're talking to a higher income client, it is income adjusted, so they might actually be paying more than that 165. And if they have Medicaid coverage, some states, they will actually pay for that Part B premium for them. So they might not be paying anything at all if that Part B premium is covered. So a lot of times, if you're in a house with someone who has Medicaid and they're paying that Part B premium, a helpful thing to suggest to them would be, hey, have you checked with your Medicaid office to see if they can cover that Part B premium for you? And the final thing on that is it is deducted directly from their Social Security check every month. The only time it is not is when they first turn 65 and they are not getting their Social Security benefits yet. If they get that Part B premium and they're not getting Social Security yet, they will get a quarterly bill in the mail. So if they're waiting until they're 67 to get their Social Security, because some people do that, they will have to pay their Part B premium every 3 months through the mail. So if someone's talking to you and they say, oh, I have this huge bill for, I don't even know, $400 something, it's because they're getting 3 months of that $164.10. They're getting all 3 months at once. So it's a little alarming for them, but you can assure them, hey, that is all through the government. That's the Part B premium. Nothing to worry about there. Now, Part C, we have A is inpatient, B is outpatient, C is where it can get a little confusing. Those are all Medicare Advantage programs. So Medicare Advantage plans. So the next part we're going to talk about is Part D. Part D is for prescription drug plans. So if Part A is inpatient, B is outpatient, Part D is prescription drug programs. These prescription drug programs are offered by private insurance companies. So a lot of times if people are on original Medicare, which is A and B, If they are on original Medicare, they are required to have a Part D drug plan, and that is typically through any of the private insurance companies. So it could be Aetna, WellCare, Humana. You'll see all of the different companies. And so whenever someone says, oh, I have this company or that, you want to ask to look at their card to see if they're talking about a prescription drug plan, so a Part D program, or a Part C plan, which is what we're going to talk about next, Medicare Advantage plans. But the final note on Part D is Part D drug programs all come with a premium that is, again, deducted directly out of their Social Security benefits, the senior Social Security benefits. So they might not even know what they are paying for their Part D plan because it comes right out of their Social Security check every month. And those Part D programs cover prescriptions and give the seniors co-pays for those prescriptions. Now, the final part we're going to talk about, we've talked about A, inpatient, B, outpatient coverages. That is original Medicare. And we've talked about Part D, which is prescription drug programs. The final one we're missing is Part C. Now, this can be a little bit confusing, but Part C are actually Medicare Advantage programs. They are an alternative to original Medicare. So typically with Medicare, you have two paths. You can go the original Medicare route, or you can go the Medicare Advantage route, which is Part C. So original Medicare is A and B, and then you have your Part D drug plan, or you can go the Advantage route, which is just Part C. And those Part C Medicare Advantage plans typically have the prescription drug plan built into them. So that's why they're called MAPD plans, Medicare Advantage prescription drug plans. Now, these Medicare Advantage plans are required to cover everything Part A and B cover, but they also include dental and vision, like I said, prescription drug plans, over-the-counter benefits, and things like that. So in the next video, we're going to talk about the main differences between going the original Medicare route and the Medicare Advantage route, and the pros and cons of each, and equip you to sell and be educated in these houses so that you can tailor fit the plans that we work with to our clients' specific needs.